So in adjuvant therapy, I think based on the affinity study, at least statistically, it was significant. But at this point, I think we all haven't changed much of our treatment. We still use pertuzumab for the indication that was approved in the neoadjuvant setting, meaning more than 2 centimeters or node positive. I think a big question mark is what to do after these 6 cycles of neoadjuvant therapy, or whether you give Adriamycin followed by 4 cycles of dual anti-HER2 therapy. And I think it's a big unknown. I think for me at this point, the use of pertuzumab, I'm doing a year based on what the FDA approval and the affinity trials. Some of it is given neoadjuvant, the rest is given in the adjuvant setting after surgery. As for neratinib, the study was positive and continued to be positive even at the 5-year follow-up after the first report at 3 years. So I do think that that study remained positive with a 2 to 3% benefit. Most of the benefit seems to be in the estrogen positive subgroup, where it was around 4 to 5%. One big question is that none of these patients actually did receive pertuzumab. So a question always comes up, what is the potential benefit of neratinib following 1 year of pertuzumab therapy? And I don't think we have the answer to that. I don't know if we'll ever get the answer to that based on the size of the 2 studies, Affinity and Extenet. But I think at this point for me, if someone was really high risk and I committed them to 1 year of pertuzumab therapy, especially if they're ER positive disease, I am recommending neratinib in the adjuvant setting.